We've been talking to doctors Glanville and Saunders about the various treatments out there that researchers are hoping can put a stop to COVID-19 and or help patients that are really advanced. Now, James is a New York comedian who says his cough was so severe that he truly thought he just simply wasn't going to make it. Then he was given hydroxychloroquine and then chloroquine, which he says ultimately saved his life. So thank you so much, James, for joining us. I really appreciate you being here to tell us about what happened.
Thanks for having me, Dr. Phil.
Well, so this was really bad for you, and you thought it was like curtains. It was going to be the end of the line. And then they gave you first hydroxychloroquine, and that didn't really help, but then they gave you chloroquine, correct?
Yeah, what happened is I went into the hospital March 15th. They tested me. I had already had bilateral pneumonia. I had severe aches and pains. I couldn't breathe, and I had that cough that everybody talks about, that you cough so much you just can't catch your breath. By Tuesday, the 17th, is when they told me that I tested positive, and they had given me the hydroxychloroquine. They gave it to me in the morning. They gave it to me in the afternoon. The next day, Wednesday, they did the same thing. And then for some reason, Thursday, my doctor switched me from that to just the chloroquine. At this point, I thought I was going to pass away. My numbers were horrible. My oxygen level was at 87, 88. My breathing was bad. My blood work was horrible. And I called my wife on Thursday morning and said, I am not going to make it. I thought I was really one coughing fit away from passing out. I figured if I passed out, I may not come back. But they gave me the chloroquine Thursday morning, Thursday afternoon. And about midnight Thursday night, I woke up and I said, I feel a little bit better. And then Friday, I felt better. Saturday, I felt better. And Sunday, I called my wife and I said, I feel this is manageable now. I feel like I'm coughing less. I'm not gasping for air. I mean, felt like I was drowning. I was gasping for air for like 5 days.
Yeah, well, apparently you kind of were, from what I understand. But were there any side effects from taking the medication?
For me, no. I had zero side effects. I felt like within a couple more days, I was really just kind of back to my old self. They had me on it for 10 days. I believe it's somewhere around 1,000 milligrams a day. So once I was done, I got out of the hospital by April 1st, and I've been okay ever since.
This is usually a drug that treats malaria, sometimes lupus, and Rita Wilson, Tom Hanks' wife, took this drug as well and experienced extreme side effects, according to her. So it's great that you didn't. I'm really glad that you responded to it and you did so quickly. Is this a reasonable drug to be treating this disorder with? And is this something that is likely to be used widespread until something better comes along?
There basically are three repurposed drugs: chloroquine, Kaletra, and remdesivir, that were being tested widely. It was on the Chinese and the South Korean protocols, and it's being implemented for severe cases in the US protocols. The evidence is still a little complicated on how effective it is. There was a French study that came out that suggested it wasn't helping that much. There's a couple different reasons why we think it could help. The challenge here is that 90% of people who are in a hospital are going to recover. And so we don't know right away if we've given the medicine, did the medicine help, or were they just have gone and gotten better at that point anyway? I would say right now they should give it, and they should continue to evaluate the studies to see if, even if there's a little bit of a benefit, are you turning the corner because he responded well to the medicine, or was his immune system kicking in and that's what helped him turn the corner? And the way you answer that question is you monitor large numbers of people. At this point, you should throw all the spaghetti against the wall, as long as there aren't serious side effects. I would say of the ones that I would give a patient, if you have the serum from a convalescent patient, I think that is the one I would prefer to receive. But the problem is there just aren't that many donors compared to the numbers that are sick. So that's where we are. And I realize that's sort of a murky answer, but that's where we are, unfortunately, in the medical practice, is we're trying to give medicines without a lot of knowledge behind which ones are the most effective.
Well, I totally agree with what you're saying, though. When you get to a bad spot, you do what you can do. Dr. Saunders, what do you think about it?
Yeah, I agree. The data is still not there yet for us to really recommend any of these. Our hospital, we are starting to give convalescent serum as well, and we're hopeful that's going to work as part of a trial. But we're still waiting for really good data on any of these treatments.
If you get into a situation where it's downhill, it's worth trying the different things, correct?
Yeah, as long as the side effects are tolerable. Hydroxychloroquine does and azithromycin does have some cardiac side effects, and it's not safe for every patient.
Of course. All right, coming up is Doctors Ray